Hildegard Peplau was born September 1, 1909 in Reading, Pennsylvania, the second daughter of immigrants Gustav and Adelaide Peplau. She was one of 6 children, having 2 sisters and 3 brothers. As a child, she witnessed the devastating flu epidemic of 1918. The personal experience greatly influenced her understanding of the impact of illness and death on families. She began her nursing career in 1931 as a graduate of the Pottstown, Pennsylvania School of Nursing. She then worked as a staff nurse in Pennsylvania and New York City. A summer position as a nurse for the New York University summer camp led to a recommendation for her to become the nurse at Bennington College in Vermont. There, she earned a bachelor's degree in interpersonal psychology in 1943. At the university and through field experiences at Chestnut Lodge, a private psychiatric facility, she studied psychological issues with Erich Fromm, Frieda Fromm-Reichmann, and Harry Stack Sullivan. Peplau's lifelong work was largely focused on extending Sullivan's interpersonal theory for use in nursing practice. From the years 1943 to 1945, she served in the Army Nurse Corps and was assigned to the 312th Field Station Hospital in England, where the American School of Military Psychiatry was located. Here she met and worked with all the leading figures in British and American psychiatry. After the war, she was at the table with many of these same men as they worked to reshape the mental health system in the United States through the passage of the National Mental Health Act of 1946. In the early 1950s, she developed and taught the first class for graduate psychiatry nursing students at Teachers College, Columbia University. In 1952, her seminal book, Interpersonal Relations in Nursing, was published. She completed it in 1948, but publication was delayed for 4 years because at the time it was considered too revolutionary for a nurse to publish a book without a physician co-author. Peplau earned a master's and doctoral degrees from Teachers College. She was certified in psychoanalysis by the William Allison White Institute of New York City. Dr. Peplau was awarded honorary doctoral degrees from many universities, including Alfred, Duke, Indiana, Ohio State, Rutgers, and the University of Ulster in Ireland. From 1954 to 1974, Dr. Peplau was a member of the faculty of College of Nursing at Rutgers University. At Rutgers, she created the first graduate-level program for the preparation of clinical specialists in psychiatric nursing. She was a prolific writer and was equally well known for her presentations, speeches, and clinical training workshops. She vigorously advocated that nurses should become further educated so they could provide truly therapeutic care to patients rather than custodial care that was prevalent in the mental hospitals during that era. During the 1950s and 60s, she conducted summer workshops for nurses throughout the United States, mostly in state psychiatric hospitals. In these seminars, she taught interpersonal concepts and interviewing techniques, as well as individual, family, and group therapy. Peplau was an advisor to the World Health Organization and was a visiting professor at universities in Africa, Latin America, Belgium, and throughout the United States. As a strong advocate for graduate education and research in nursing, she served as a consultant to the U.S. Surgeon General, the United States Air Force, and the National Institute of Mental Health. She participated in many government policy-making groups. After she retired from Rutgers in 1974, she served as a visiting professor at the University of Leuven in Belgium, and there she helped establish the first graduate nursing program in Europe. In 1995, she was named one of 50 Great Americans in Who's Who by Marquis. She was elected Fellow of the American Academy of Nursing, and the Sigma Theta Tau, the National Nursing Honorary Society. In 1997, she received the World of Nursing's highest honor, the Christine Ryman Prize, at the International Council of Nurses Quadrennial Congress. This award is given once every 4 years for outstanding national and international contributions to nursing and healthcare. In 1996, the Academy of Nursing honored Peplau as a living legend, and in 1998, the American Nurses Association inducted her into the ANA Hall of Fame. She's the only nurse to ever serve the American Nurses Association as executive director and later as president. She was also elected to serve 2 terms on the Board of International Council of Nurses. Dr. Peplau is universally regarded as the mother of psychiatric nursing. Her theoretical and clinical work led to the development of the distinct specialty field of psychiatric nursing. Her book has been widely credited with the transformation of nursing from a group of skilled workers to a full-fledged profession. Since the publication of her work, interpersonal process has been universally integrated into nurse education and nursing practices throughout the United States and abroad. It has been argued that Dr. Peplau's life and work produced the greatest changes in nursing practice since Florence Nightingale.